backgrounds. We're going to talk about COVID-19, looking at East Jerusalem and the West Bank. So we're pleased to have with us today Jessica Montel. Jessica is the executive director of Hamoked, which is an Israeli human rights and legal aid center. And she has been a leading figure in Israeli civil society for 2 decades. She's one of my role models and heroes, previously serving for 13 years as the executive director of B'Tselem. And then we have Tarek Bakoni, who is well known, I think, to almost everyone in our audience as well. Tarek is an analyst for Israel, Palestine, and economics of conflict at the International Crisis Group based in Ramallah. He is also the author of a book called Hamas Contained: The Rise and Pacification of Palestinian Resistance, which I highly recommend. Superb book. This is, of course, a virtual meeting, as we are all doing in this era of COVID. That being said, we look forward to taking audience questions. There is a Q&A feature on Zoom, which I encourage you to familiarize yourself with. You'll see the Q&A button where you can post your questions there. If you're calling in by phone or watching this on a live stream, you can tweet your questions using hashtag MEI events, or you can email events@mei.edu. We'll do our best to get to as many questions as possible. And if you have any technical issues, use Zoom's chat function to let us know, or email again, events@mei.edu. Feel free to ask a question at any time throughout the panel. We will be looking at these throughout the event, so we'll try to keep track of them as we go. So with that, we are going to begin. And I'm going to start off by throwing a question to Tarek. Tarek, can you give us a snapshot of the current situation in the West Bank, including East Jerusalem? We see increasing numbers. Everybody is watching this every day. Numbers are not as high as what we're seeing in Israel, but they're increasing. They're increasing in particular, we're seeing in East Jerusalem, or the Jerusalem Directorate. And there's the sense that as more and more laborers come back and forth across the border, or in areas like East Jerusalem where people maybe don't have the same level of testing, it may be higher than we know. So what is it looking like, and what are the main challenges the PA is facing in dealing with this in East Jerusalem and the West Bank?
Well, first off, thank you, Lara, and thank you, Khaled, for having me on this panel, and it's wonderful to be here with you, Jessica, as well. I should begin and preface my answer by saying I'm actually not in Ramallah at the moment. I am based in Ramallah, but I am currently, like many people who are stranded and stuck in different places, find myself stuck in London. But I'm still very much in contact with people on the ground and trying to follow up with what's happening in Palestine. So the situation in the West Bank and Jerusalem, as you said, it still is quite tense. I mean, the most obvious thing is that the lockdown is still very effective. Everything is shut down. The restaurants, all forms of public gatherings are still forbidden. And there's a curfew for even going grocery shopping, going out of the house, and that's enforced quite stringently. Now, there's a lot of things to talk about in terms of the current situation and why what you said is true, that the cases in Palestine tend to be lower than they are in Israel. It has a lot to do with the initial responses that the PA put in place when this began. And we can talk about the effectiveness of that response in a moment. But just in terms of a snapshot, is to say that the biggest challenge the PA has today is in terms of its ability to deal with a possible surge in the virus. The healthcare system is quite impoverished and does not have anywhere near the capacity of what would be needed to deal with a substantial outbreak. To give you just a figure, I have here, there's 205 ventilators that are currently available by the PA hospitals or public hospitals. And the assessment is that that's only 10% of what would be needed if there was a full outbreak in the West Bank. So I'll leave it at that. I'll be happy to give more insight into each of those areas.
Thanks, Tarek. Turning now to Jessica, could you give us a sense of where Israeli policies are? Obviously, there are different regimes in place in the West Bank versus East Jerusalem versus sovereign Israel. But of course, with Israeli responsibility and control over all of these areas, how are the Israelis responding to the COVID crisis, particularly as they relate to their policies in the West Bank? Have we seen an easing, for example, in terms of the occupation practices, or things like home demolitions, for example? Are these extenuating circumstances that are causing any change in policy with regard to the Israeli occupation? If you could give us kind of a big picture and then zoom in on some of these aspects, that would be great.
Yes, so first, thanks for having me in this forum. As always, Israel is primarily concerned with itself, concerned with Israeli citizens. And I know later in this series, you'll be looking at distinctions between Jewish and Arab citizens inside Israel. But almost all of the policies that are being taken are focused on the welfare and safety of Israelis. And often the neglect toward Palestinians could just be an oversight. I mean, one tiny issue that we dealt with, when it was clear that people should not be going out, standing online at the Ministry of Interior to be extending visas, they extended all the visas until the 30th of June. But the visas that were extended didn't apply to, you have 10,000 East Jerusalem families that one member of the family is a West Banker living in East Jerusalem on what's called a stay permit from the military. So it's possible that's just not on the radar of people making decisions, these 10,000 families. And then Hamoked and other organizations sent a letter, and that was added after a few days, added to the list of categories. Just today that we heard, you have Jordanians that are visiting family members in the West Bank. They're on tourist visas. Initially, those categories were not included. They have a tourist visa to the West Bank. So this automatic extension, they're thinking about, people who come from Europe to visit Israelis on tourist visas. Those were automatically extended. Today also, we received notice that those people also don't have to leave their house, go to the Ministry of Interior in order to be renewing visas. So I would say, one category of concern is just neglect, that Palestinians are not on the radar. But there is also this concern about, in the fog of the war that we're calling it, this, battle against the coronavirus, that the same sorts of agendas of settlement, furthering settlements, entrenching occupation is also being pursued. In terms of the manifestations of occupation, you have fewer arrests taking place. You still have home demolitions, you still have arrests, you still have violence. Those sorts of dramatic events have definitely declined, are still continuing, but declined. But, this main feature of this permit bureaucracy of being ruled by a foreign military that is not taking your welfare into account, those features of occupation are certainly entrenched and not changing.
Great, thank you, Jessica. Tarek, I wonder if you could sort of build on the discussion a little bit by, we hear a lot about, actually I want to ask you two things. One is sort of a follow on of where the discussion was headed. And then the other is I want to ask you a more specific question about Israeli-Palestinian cooperation. The first question is, are there pockets, given the different regimes that we have in place in the West Bank and in East Jerusalem, are there pockets of people, groups, communities that sort of fall through the cracks, who are not encompassed really by Israeli policies or Palestinian policies? And I'm thinking specifically of particular parts of East Jerusalem. And if you could, and actually that could be for either of you. And also if you could talk a little bit about, we hear a lot about Israeli PA cooperation in this time of crisis. I read that there is a joint sort of war room or operations room in which they're trying to coordinate their responses. Even though they have very different policies, there's a lockdown in the PA controlled areas, but Israel is not yet under lockdown. So if you could address both of those, and of course, Jessica, we'd welcome your responses on those as well.
Thank you, Khaled. Yes, I'll say a few things about those. So just to give, in terms of context and numbers, so there's now 134 cases in the West Bank, including East Jerusalem, and the majority of those are still outside of Jerusalem, so they're within Palestinian West Bank, but there has been a surge over the past couple of days within Jerusalem itself. And this is an area that, as you say, is falling between the cracks for various reasons. Primarily, when we're talking about East Jerusalem, we're talking about 340,000 Palestinians. Some of these, the majority of these, are actually located within East Jerusalem on the western side of the separation wall. So they are within the part of Jerusalem that is still accessible without passing through checkpoints between sort of Israel 48 and East Jerusalem. And then there are areas like Kufar Aqab, which are still part of the Jerusalem municipality, but are on the eastern side of the separation wall. So communities like that, and Kufar Aqab, for example, is 100,000 people. We're looking at communities here who have are considered to be Israeli permanent residents, which means that they are paying taxes and they have access to healthcare facilities within Israel, but physically are now isolated from those healthcare facilities and are unable to get to the medical centers that they would normally be able to get to because they are on the other side of the separation wall. So communities like that are falling between the cracks, and this isn't just in terms of healthcare, but in terms of every aspect of their life, even before coronavirus, are falling through the cracks because they are in a situation where neither the PA nor Israel are providing them with the services that they need to be getting, and this becomes particularly an issue in the time of Corona, because whereas there is a need for emergency responses and rapid availability of healthcare, we see this community in essence languishing and unable to get any kind of attention for what will be what is likely to be quite a significant outbreak. So there's a lot of issues in there, and some of the issues in there are similar to those that are faced by other vulnerable communities. The fact that those areas are overcrowded, the fact that it's very difficult to impose any kind of lockdown, the fact that there's years of systematic neglect, which means that the hygiene is not where it needs to be, with the fact that there's a distrust of the authorities and the distrust of both the PA and the Israeli occupation forces. All of these factors play a role here in shaping how able these communities are to weather a COVID-19 outbreak, and how likely it is that an outbreak like that could occur in these locations and then move beyond them. So the situation in East Jerusalem is quite particular, and we can talk more about that. In terms of the cooperation, now I mentioned in my first answer that part of the reason why the numbers are so different between the Palestinian territories and Israel is because in the West Bank, there was a very immediate effort to lock down. After the initial round in Bethlehem, there was a decision that was taken to separate, to place it under lockdown and to prevent any kind of movement between the Palestinian cities. Now, that is very much still there, and that rapid response by the Palestinian Authority has been lauded, and it's been seen as being something that's very positive. I mean, Prime Minister Shtayeh's ratings in a recent poll yesterday was 85% approval rating. So that's unprecedented for Prime Minister Shtayeh, and we can talk about that. But what that has meant is that this has given the veneer that the Israeli authorities and the PA are working hand in hand to manage the situation. When that's actually quite a misrepresentation of reality on the ground. It places the PA and Israel on an equal footing, when in fact the PA is very much here placed in a situation where it's imposing a lockdown, obviously for its own fears of an outbreak. As I said, the healthcare system is struggling and would struggle with an outbreak, but is also operating within and under an Israeli sovereignty umbrella. They're operating within Israel's occupation framework. The directive to have a lockdown in the Palestinian territories very much came from the Israeli authorities. It was Defense Minister Naftali Bennett who called for all the borders to be shut down, who called for Israeli security forces to be present in Area C to prevent movement between the Palestinian governorates. So whereas there is definitely a sense that the PA is being quite effective, we shouldn't look at this kind of cooperation as a breakthrough or as an equalization between the parties. What's happening is very much an institutionalization of the Palestinian occupation of the Palestinian territories, and an enforcement of the lockdown through its military regime. And here I just want to end before passing the mic, as it were, to say that the occupation forces is still very much active. The fact that there's still encroachment and incursions by the Israeli security forces into Ramallah yesterday. There's still acts of home demolitions, and there are also acts of restricting and undermining efforts by the PA to deal with the health crisis. And I'm referring here to last week's confiscation by the Israeli occupation forces of material that are used to build coronavirus clinics in the Jordan Valley. So this isn't a form of cooperation. What's happening is very much an Israeli implementation of the occupation and an implementation of a lockdown through a military regime in order to try to manage the contagion, as Jessica says, for the benefit of its own civilians.
So can I jump in on this about East Jerusalem and this, let's call it division of labor between Israel and the Palestinian Authority? You had two, I think, illustrative events this week. One in Sur Baher, which is an East Jerusalem neighborhood not separated by the separation wall, and Kufr Aqab, which is on the other side of the separation wall. In general, Israel is, you could say, even obsessive about rooting out any involvement of the Palestinian Authority in East Jerusalem activities. My office, Hamuked's office, is right next to El Hakawati Theater. And, you know, once every few months, all of a sudden you have a police raid on, you know, little kids in traditional Palestinian dress about to give a dabka dance performance. If it turns out that the PA has funded that or is in any way involved, Israeli police come and shut it down. So inside East Jerusalem, you know, they are really aggressive about preventing any involvement of Palestinian Authority in activities. But you had this event in Kufr Aqab where the Palestinian police went in to settle a violent dispute within the neighborhood, armed Palestinian police operating in East Jerusalem with the consent and permission of the Israeli authorities. So it's something unprecedented, but also indicates, you know, the way that Israel has somehow divorced itself. And that's why we're particularly worried about these efforts to maybe shut off Shuafat and Kufr Aqab, which are the two neighborhoods beyond the separation wall. You know, the residents there should have all the rights and benefits as East Jerusalemites. And I give the contrasting story of Sur Baher, where there was a raid on a truck of welfare relief coming to distribute food and other supplies in Sur Baher neighborhood in East Jerusalem. There was suspicion that it came from the Palestinian Authority, and then the police stopped the truck. In fact, it came apparently, according to Nir Hasson, who reported on it, from Kfar Qasim inside Israel. But to see the response of the Israel police in these two Palestinian neighborhoods, you know, shows very clearly where there is, you know, the intention to be maintaining Israeli sovereignty and the areas where they are trying to divorce themselves from responsibility.
So, Jessica, if I can ask you a follow-up question to that, and you and I talked about this a little bit offline. You talked a little bit, you mentioned the fog of war policies. You know, there is, I think, suspicion among some people looking at the moves to potentially use COVID, either because genuinely you're trying to fight COVID or there's another agenda. You know, there's been a long time aspiration to cut Shofat refugee camp off from Jerusalem. There's been a long time aspiration to take Kfar Akim and say, okay, this is now part of the PA. I mean, we've had bills in the Knesset to do this. A place like Nebi Samuel, which today is, I think Hamoked actually wrote something about this. This is an area that is trapped inside the barrier, but they're West Bankers. They have no access to health in East Jerusalem because they're not allowed to move, and they can't get to the West Bank except by crossing checkpoints. I mean, this seems, one could argue, now is a moment to finish depopulating a place like Nebi Samuel. Looking at the map, is this a fog of war where between travel restrictions and changes in how you deal with the areas around Jerusalem, we're seeing maybe some implementation of what is effectively the Trump map or the annexation plan, where you start really hardening that archipelago in the West Bank, where settlers live under one regime and can move around, and Palestinians are now solely responsible for their own affairs inside these little bubbles. And in Jerusalem, you start really reshaping the borders along the lines of what we saw in the Trump plan.
Yes, so I've been thinking a lot this past week how coronavirus is the new security justification. You know, it used to be that everything that Israel is doing is justified as necessary in the name of security. And you have things that actually might have some security benefit, and you have to see, is it disproportionate? Is it discriminatory? Is it, illegal, even if it has some security benefit? And then there are things that are done, justified in the name of security. This, the expansion of settlements or the closure on Gaza. There's very little security benefit to them, but it's enough to say necessary for security. It shuts off almost all critical thinking and analysis. So today, to say something is necessary for the fight against the new coronavirus, you're going to get very little pushback and very little resistance. It's the same kind of danger that then we're not scrutinizing all of these policies. And the examples you gave, I think, are excellent. Nebi Samuel, which they have put up a checkpoint preventing any movement between Nebi Samuel and the West Bank. Their only access in and out of that village is through the Elgindy checkpoint to get to Ramallah, and that has been closed down. Why? What is? Again, it's as if it's necessary. Everywhere is being locked down, right? We all are in some way or another being locked down, so it's easy to sort of assume that serves some COVID-19 benefit. But in fact, it seems much more likely that it's part of this long-standing policy to suffocate Nebi Samuel, to get rid of them. They're in an area that has been defined as a national park because of the archaeological site there. They have been under very severe restrictions forever. And then, this new measure that we haven't even seen the official justification to it yet, but again, seems to bear no legitimate link to actually fighting COVID-19. And Shuafat is another good example. You have this battle. They are threatening to close off Shuafat so that people from Shuafat would not be able to enter the rest of Jerusalem. And then it's a battle between apparently the mayor's office, right, that wants sovereignty over all of Jerusalem, sees all of Jerusalem as under his jurisdiction, and the National Security Council, with, much more likely to be advancing this political agenda rather than any public health considerations. The third example I would add to those is the restrictions on crossing into the seam zone. All of these agricultural areas trapped between the separation wall and the Green Line in the northern West Bank. where the restrictions are very much like restrictions on entering Israel, and the soldiers standing there, people above age 50, Palestinians, are not allowed to cross, although in fact that's a restriction on workers now. Workers above age 50 not allowed to cross inside Israel, some sort of quotas on people. Again, you're talking about people walking 50 meters down from their house to get access to their farmlands. There's no rational link to the fight against the coronavirus, but it's sort of put into this big package of public health measures.
Thanks, Jessica. So, Tarek, I wanted to put a couple questions to you. Obviously, prisoners of any sort are among the most vulnerable populations. So what is the situation with regard to Palestinian prisoners in Israeli jails? I think there's, well, you probably know the numbers better than I, but at least 5,000 or so. And sort of related to that, we have, there are reports in the Palestinian press of day laborers or long-term laborers who work in Israel. There's maybe 130,000 or so total, and about 35,000 were recently returned to the West Bank. And given the high infection rates in Israel and the very rapid increase there, what does that mean for, when you have 35,000 Palestinians returning from Israel to the West Bank? What can the PA do? Obviously can't put them all in quarantine. And how vulnerable are they? And then I'll leave that question there for you about the prisoners and the returning laborers.
Thank you, Khaled. I think to answer both those questions, I just want to give a bit of a sort of a background context to take a step back and actually begin with the question that Lara just asked and that Jessica answered very eloquently. I want to add to that and say that, if we're looking at what's happening now, if we're taking a step back and looking at the map, we're seeing the actualization of the Trump plan in terms of the day-to-day running of things on the ground. We're seeing the Israeli security forces very much present in Area C. We're seeing all of the Palestinians being unable to move out of their separate bubbles within Area A. And we're seeing the discourse around that being a discourse of the PAs actually taking control of the Palestinian urban centers. The Israelis are doing their thing, and there's a cooperation between them. This is essentially a formalization of a dynamic where we have a two-state solution, with the Palestinian state being the entity that's dealing with the archipelago within the Palestinian territories. The way we need to be looking at this outside of and the one thing I would add on that is to say that, as Jessica said, this is put through the measure of security and public health, but there's nothing to say that this is going to be temporary. And this, I would refer viewers here to a piece by Sari Bashi recently about how these temporary measures are passed at times of conflict, whether it's the intifadas or other areas that are quote unquote security related, but they tend to become permanent. And so in understanding this dynamic, I think instead of viewing it on that kind of equal footing as Israeli-PA partnership on those things, what we need to be seeing is the Palestinians here being recognized as a population that's under Israeli occupation. What that means is that if there is to be any kind of healthcare assistance given by the Israelis to the Palestinians, it's not assistance per se, and it's not humanitarian aid. It's actually their responsibility under international law to make sure that those Palestinians have the same access to healthcare that Israeli citizens do. So in that instance, within that kind of framing, which is, I think, a more accurate description of reality, let's talk about the prisoners and let's talk about the day laborers. I'll start with the day laborers. There's about 130,000 Palestinians who cross every day to work in Israel. And those people these numbers vary, and some of those numbers have official permits from Israeli authorities to cross over, others do not, and sort of this also takes the mask off the security argument that the separation wall is there to prevent the entry of Palestinians into Israel. Many Palestinian laborers enter Israel without those permits. After the outbreak of the coronavirus, there was a decision by the Israeli government to call on Palestinian laborers who are in quote unquote essential services to stay within Israel for a period of 2 months in order to prevent the movement back and forth between Israel and the West Bank in a desire to maintain a kind of lockdown on the Palestinian territories. Out of the 130,000, about 35,000 Palestinian laborers accepted that call. And there was then, as part of that decision, the Israeli laborers, their employers, were tasked with providing them with adequate accommodation and with adequate facilities for the duration of their stay in Israel. Fast forward a couple of weeks, what we're seeing is that those Palestinian laborers, first of all, were present in an environment in which there was greater outbreak and greater numbers of people with COVID-19 than in the Palestinian territories. But more importantly, we saw instances of Palestinian laborers who were starting to show symptoms of this virus being thrown back into the West Bank without adequate healthcare and without any kind of support for them to sort of deal with the fact that they were exposed to the virus in Israel. So this resulted in Prime Minister Shtaya calling on all these Palestinian laborers to come back into the Palestinian territories. And this is the influx of the 35,000 that you're talking about. Now, there is a quarantine facility in place to try to manage the kind of the possible outbreak that something like that would entail, but this is an example of the Israeli government choosing to allow 35,000 Palestinians to be in Israel when they're needed as labor, and when they're not, and when they're infected with the virus, being thrown back into the Palestinian territories where then any kind of healthcare support is described as humanitarian. The one other thing that I would say on the issue of laborers is that there are Palestinians also who work on settlements who do not have the kind of support that they would need and still have the high exposure they do to Israeli citizens living in settlements as well. And there's about 30,000 of them as well. And the PA has called on them to stop working in settlements too. Now, just in terms of the prisoners, and I'll do this very quickly, there's about 4,500 Palestinians who are held in security detention or prison facilities within Israel now. With prisons elsewhere, those communities are vulnerable. They do not have access to adequate healthcare, and they are obviously in confined spaces. There's been a history of maltreatment and inadequate access to healthcare, and obviously inadequate access to a due legal process for many of these prisoners, a proportion of whom are elderly and others who are children. And a lot of these prisoners, even before the outbreak of the coronavirus, have died because of lack of access to chemotherapy and other forms of important medical assistance. Now, there's been a call for Israel to release those security detainees and to release the Palestinian prisoners. And these calls are only gathering force. Yesterday, or I think today, there was confirmation that one of the prisoners who was held in administrative detention since March 18 in Al-Far prison has now been released, and it has been confirmed that he has coronavirus as well. And he's been in contact with a number of prisoners within Al-Far, obviously before his release, which means that an outbreak is very much imminent, and there's very, very little faith that Israel would provide the Palestinian prisoners with anywhere near the kind of healthcare that they need.
So if I can jump in on prisoners to add, the other concern, the distinction between between security prisoners and criminal prisoners also affects their ability to be in contact with lawyers and their families. So the vast majority of Palestinians from the West Bank that are defined as security prisoners, they have no access to phone calls. They're not allowed to make phone calls compared to the criminal prisoners inside Israel. And this now is particularly significant because you no longer have any visits. All visits have been canceled. No families, no lawyers visiting Palestinians in detention. So you have two petitions that will be heard tomorrow at the High Court of Justice demanding that Palestinians be given access at the very least to phone calls one petition focusing on both adults, but with a particular emphasis on minors, that Hamuker is leading this petition, and the second by Adala, with the focus on access to attorneys, because this population that, as Tariq said, is vulnerable in these very overcrowded conditions, is also completely cut off from the outside world with no way to be monitoring what's going on there.
So if I could ask both of you to sort of shift gears, we looked at all things that are terrible. Imagine now, I'm going to start with you, Jessica, you are now talking to Israeli security authorities who are asking you, what should we be doing? What should change? Assuming that there was actually political will, and a crisis sometimes creates opportunities for things to move in a different direction. So let's imagine they would. We can be hopeful, if not optimistic, that that might happen. What should Israel, if it is taking proper responsibility as it has as an occupying power, what should it be doing vis-a-vis helping do what it needs to do to make sure that coronavirus is treated correctly in the West Bank and East Jerusalem, and not just inside the Green Line? And also for the international community. I mean, that's another question, because of occupation, there are international obligations as well. So blue skies, let's hear some what should happen.
Yes, so starting
I'm sorry, if I could just throw in also the Palestinian Authority, what should they be doing as well?
So if we take as the starting point, Israel has the legal obligation to be taking care of the welfare of all people under its control, citizens and residents and the protected population under Israeli military occupation. Israel has a legal responsibility for all of those people's welfare. That has to be the starting point for public health policies. And also the principle of non-discrimination, the slogan that the coronavirus doesn't discriminate, to be protecting all people equally, resources mobilized for the welfare of all of these populations. I mean, of course, the needs are different, but starting with the fact that the Palestinian healthcare system is not in a position, again, partly because of occupation and neglect, not in a position to be dealing with the epidemic. And also you have to take into consideration, when you consider the Palestinian healthcare system, two of the most advanced hospitals are in East Jerusalem, the Muqasid and Augusta Victoria, which should be considered as part of the Palestinian healthcare system. Access to those hospitals is solely under the control of Israel. So the starting point would be the state of Israel, looking at all of these different populations, assessing in terms of testing, in terms of mitigation measures, in terms of treatment for those, isolation treatment for people who are sick, and preparing for a further outbreak and deterioration, that all of the country's resources have to be mobilized for the benefit of all of the people under Israeli control.
Got it?
Yeah, I mean, I completely agree with that. I think that the way that the Israeli government has been looking at this is to try to think about how they can provide sufficient ventilators, sufficient hygiene kits, sufficient testing kits for its own citizens, and positioning itself as a conduit for that kind of material and those kind of medical supplies to reach the Palestinian territories from international organizations. So they would say, the Israeli government facilitated the World Health Organization's transport of these medical supplies, these hygiene kits, to the Gaza Strip or to the West Bank. This is not the way that it needs to be framed, and it's not the way that it needs to be pursued. The reality of the situation is that in its own planning, within the central government, within the Israeli central government, in its own planning in terms of how much medical supplies does it have, that planning needs to also take into account all the Palestinians under its control and occupation, whether they're sitting in Jerusalem or the West Bank, the rest of the West Bank, or the Gaza Strip. So what that means is there's 200 ventilators that are now present in the West Bank, there needs to be at least, for an outbreak of about 12,000, there needs to be about 2,000 ventilators. So that's less than 10% of the amount of ventilators that are needed to deal with the worst case scenario in the West Bank available. That's on the Israeli government to supply. That's not on the World Health Organization to supply through the Israeli government. So that's the first thing that I would say. The second thing is we should really think about UNRWA as well. I mean, UNRWA is a big healthcare provider, and it has facilities that are present in Jerusalem, that are present in the West Bank, particularly to refugee communities that do not have access to the medical healthcare that other communities might. And the defunding of UNRWA that's been part and parcel of the Trump plan needs to be revisited. So this needs to be not just for the Israelis and the Palestinians, but for the international community to revisit the way that they think about UNRWA and to see the importance of funding an organization like UNRWA precisely for this kind of outbreak. The last thing that I would say in terms of how the Israeli government should respond to this is that freedom of movement, so everything that has to do with permits, has to be suspended for all medical purposes, and this applies obviously for Jerusalem and the West Bank, but most importantly to the Gaza Strip. The idea that Palestinians in the Gaza Strip would not be able to leave Gaza where they can find better treatment because of the blockade at a time of a pandemic is obviously a form of collective punishment and needs to be revisited. The blockade has to be lifted, checkpoints have to be lifted for the purposes of medical travel and medical treatments. What can the Palestinian Authority do? I mean, there's a lot that can be done. The healthcare sector in the Palestinian territories has been crippled by inadequate supplies, by the occupation, just like the economy has, just like everything else has. And I think that the PA has done as its role in terms of administering various parts of the occupation, done a very good job at ensuring a lockdown and preventing the movement of Palestinians between the different areas. It needs to keep doing that. There needs to be more effort to try to secure tests, try to have more testing kits available. Again, this is Israel's responsibility, but in the absence of Israel doing that, the PA should be doing more of that. And I know that they have been putting out different kinds of efforts to try to secure those medical supplies. Those need to continue. And there needs to be more awareness raising campaigns. Alongside the lockdown, there needs to be more outreach to communities like Kfar Aqab, like other refugee camps, where it's very difficult, as I said, for structural and systematic reasons to ensure a lockdown. There needs to be more awareness raising and more outreach to those communities to get testing done, to deal with the suspicions that they have about what might happen with different cases who test positive, and to try to get the public on their side in terms of fighting the outbreak.
Great, thank you. I mean, all of this kind of highlights to me that, you know, there's a natural impulse on the part of Israel as the occupying power, as the party that is in the most control, to want to entrench and sort of deepen those policies. On the other hand, given everything that we've discussed and that we've heard from both of you, there's a real potential that could come back and ultimately be to Israel's disadvantage, in the sense that, you know, ignoring Palestinian prisoners, for example, increases the risk for Israeli security guards and others in those facilities, and then, of course, the risk of transmission. So there is no way really to contain this situation along the lines politically that, or even from a security standpoint, that Israel has been pursuing thus far. And so it sort of raises this paradox in my mind of there's this kind of, there's a tension between Israel's impulse to want to expand its occupation and ultimately what could come and backfire in terms of pursuing its policies. And one thing that I think you'd think would be in Israel's interest would be testing. We don't actually know how many cases there are in the West Bank because they have far fewer resources, far fewer test kits. And so the numbers could be low simply because of the proportional testing is much lower. In any case, I think now we have an opportunity to move to some questions from our audience, and they are growing, the questions. I'm going to start with a question from Daniel at the Consulate Consulate General of Spain in Jerusalem. In the last weeks, especially after the measures of isolation taken by the PA in Israel to fight COVID-19, we've been watching an increase of acts of settler violence against Palestinian communities, individuals and goods in the West Bank and East Jerusalem. Can you tell us a bit more about this issue? Is there really a spike in settler activity or settler violence in this crisis, or is it simply that we're paying more attention to it?
So this is an ongoing problem. I don't think it's a spike precisely now. I think it's more of the same. And the more of the same is two populations living side by side, where the security forces see their role as protecting one population from the other. I mean, protecting the settler population from any acts of Palestinian violence. And then there is a very indifferent response to acts of violence by settlers against Palestinians. It's an ongoing problem. I mean, I think it generates maybe more attention now, the same way that it seems inconceivable that the security forces are going into Palestinian communities when they are in lockdown, and you see Israeli soldiers in full protective gear from the coronavirus to be carrying out arrests. It's not that there are more arrests now. In fact, there are less, but it just seems ludicrous when we should be mobilizing all of our resources against this threat to all of us, that you have on the one hand acts of violence by settlers against Palestinians or arrest operations or other human rights violations like this.
So for thought, I want to combine a couple of questions here that are focused on the PA. So Dan Rotem is asking, I think, a great question about the ability of the PA to continue over time as we see economic recession, depression. I mean, there are challenges that everybody is facing in the world with the sort of lockdown, and those challenges are magnified in a place where the economy is already basically broken by occupation or barely functioning. Harry Reese has also a question about what you discussed before, which is this idea of cooperation, PA, COGAT, who's really responsible? Is there really a joint body, and is it functioning? If you could sort of go more into sort of the technical parts of how that is operating to the extent that you know.
Thank you. Great questions. I mean, in terms of the capacity of the PA to survive this, I think that, you know, in some ways, yes, in some ways, no. So I do think that there's been a significant shrinking in terms of the ability of the PA to secure kinds of funds that it would have normally, or let's say in the heyday of the Oslo days, been able to secure. I do think that it's going to have to deal with what is very much a chronic financial problem that restricts its sustainability and puts into question its ability to continue indefinitely. I think this is particularly the case when we see not only the efforts taken by the Trump administration to also do a whole lot of defunding, not just of the PA, but of areas around the PA, which means that there's more poverty, there's more unemployment, there's more need for developmental aid and assistance. But also when the Israeli government continues to punitively withhold Palestinian tax returns. So what we see now, for example, is that the PA is struggling to get any kind of adequate healthcare supply anyway, and that's further a struggle that's further reinforced by the fact that the Israeli government is withholding about $10 million a month from the Palestinian Authority. So the health of the Palestinian Authority is very much in question. At the same time, I wouldn't see this as a tipping point. I mean, it could very well be one, especially if the healthcare sector is completely inundated and there's an outbreak that is very difficult to manage, that brings to the surface a crisis of confidence, public confidence in the PA as a service provider. But at the same time, there is very much the likelihood that when needed, the money will flow from the Israelis and the money will flow from the Americans, because the PA is just too important as an administrator of the occupation. So, I mean, I do think that there is a chronic financial difficulty. I don't necessarily think that would herald the collapse of the PA. I think that's always a possibility, and it could occur at a tipping point. But I wouldn't necessarily bank on it. In terms of COGAT and who's in charge of this, so there is cooperation that's happening on a committee level, I should say. There is the Israelis, for example, are sending, as I said, World Health Organization testing kits and supplies to the PA, and there's some testing that's happening of Palestinians in Israeli hospitals. So they're getting a testing kit or the ability to travel to Israeli hospitals. COGAT is very much the intermediary here between the Israeli government and the Palestinian Authority. And in some ways, I don't think that this is anything different from the way normal security coordination operates. We often think about security coordination as how Palestinians are imprisoned, or how Palestinian home demolitions are carried out under Israeli security forces, how Palestinian suspects, quote unquote, are found. But security coordination also entails things like getting permits, like moving between areas A, B, and C, like being able to cross borders into Jordan. So in some ways, this is security coordination 101. And it's just going into this process of a medical health emergency. So I wouldn't, and that's why I think thinking about it as cooperation or as something novel is very, very problematic and misrepresentative, because it's nothing more than just a normal kind of engagement that's happening between Israelis and the Palestinian Authority that's sustaining the occupation.
If I could maybe ask Tarek another question in terms of the Palestinian public, how does the Palestinian public see the situation in terms of the PA's preparedness, their responsiveness? I'm seeing general reports that people are generally satisfied, but does that extend to their views of how they're dealing with the situation in Gaza? What types of things, what sorts of measures is the PA in the West Bank taking with regard to Gaza, if any, and what are the Palestinian public's views of how well their government's performance is so far?
So as I mentioned very briefly at the beginning, within some of the recent polls that came out, the way that the government, and by government here I should say specifically Prime Minister Shtayyeh, the way that he was seen to respond to this outbreak is seen in a very positive light, which has implications around the Palestinian Authority more broadly, and we can talk about that if we have time. But so it's seen as a very promising development, and it's seen as something that goes back to the early days of the outbreak. The fact that they did institute a lockdown around Bethlehem, the fact that they were able to respond very quickly meant to many that the numbers were contained. Now, whether that confidence will continue as numbers increase remains to be seen. And so I think we're still in the early days of this crisis, but so far the response in the West Bank, and that's not to include Jerusalem, just in the West Bank, excluding Jerusalem, has been quite positive. I think with the Gaza Strip, there's still several things are happening in the Gaza Strip, but I'll focus specifically in terms of how the PA is viewed. So the PA is still viewed in the same light that it's been viewed over the course of the past few years, which is that the PA is also increasing the stranglehold on the Gaza Strip by virtue of the fact that they're looking to weaken Hamas's government. So in the current healthcare crisis, this means that there's a belief in the Gaza Strip that the PA is withholding the transfer of both revenues, tax revenues, but also medical supplies that the PA has been able to get. And that a disproportionate amount and a lower disproportionate amount is being transported from the Palestinian Authority into Gaza. So I think that there's deep suspicion there that the PA is using this crisis also to weaken Hamas, and it's not seen favorably.
So, Jessica, we have a couple questions on Jerusalem that I want to focus to you. One question is someone asking about the ability of Palestinians in East Jerusalem to access West Jerusalem. And the question here is something about whether or not they're no longer able to, and what I had not heard that. My assumption is that there's more or less of a stay in place lockdown that applies to everybody, which has implications for moving across the whole city. If you could talk about that, and if you could also talk about, someone raised here the issue of the hospitals in East Jerusalem, which speaks to a broader movement and access problem. When the main two Palestinian hospitals are in Jerusalem, even before COVID, there was an access issue. With COVID, I imagine that magnifies the problem. And on top of that, these are hospitals that are under, as I understand it, enormous financial duress because of defunding by the United States. So maybe talk about that and even go so far as to make some recommendations, which would be, I think, welcome.
Yes. So currently the situation, there are no special restrictions on East Jerusalem Palestinians as opposed to Israelis in Jerusalem. We are all under very restrictive measures. We're not supposed to go more than 100 meters from our house, all of us, except for very specific, defined, allowed purposes. So there is a lot of fear and talk about additional restrictions on Palestinians, specifically around Shuafat and Kufr Aqab, shutting off those neighborhoods. Some talk about preventing, in general, movement from East Jerusalem to West, although anyone who knows what the map looks like, I mean, East Jerusalem to West is, you have Israeli Jewish settlements in the middle of East Jerusalem. So it's not very easy to draw a quick border and hermetically seal off one area from the other. In terms of healthcare, the East Jerusalem Palestinian population is in a much better situation than West Bank Palestinians, as they are entitled to Israeli health insurance and treatment at Israeli hospitals. So when I get every day from the Ministry of Health these reports about how many COVID-19 cases they are and where they are being treated, Muqasid Hospital is within that, the broader picture of people being treated at Hadassah or other Israeli hospitals. But then that is a big problem when you think about the Palestinian needs, the needs of the larger Palestinian population, and the fact that West Bank Palestinians do not have easy access to Palestinian hospitals, and that the Palestinian health sector, when they are doing their public health planning, cannot count on access both for patients and for staff to those hospitals.
Thank you, Jessica, and thank you, Tarek. Thank you both. I think we're now just about out of time. So thank you to our audience members on behalf of the Middle East Institute and the Foundation for Middle East Peace. Thank you for joining us. I would urge our audience to check out the video. Will be posted online for today's and yesterday's sessions. And also check out Hamoked's website and the International Crisis Group for their Jessica and Tarek's incredible work on this and other topics. And please join us on Friday, where we'll be shifting the focus to Israel itself and looking at how the COVID crisis is playing out there. Friday at 11 a.m. Eastern Time. And thank you all.
Thank you for having us.
Thank you.